Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. Today's short but important topic: 3 drugs that have been making news in fatty liver care: semaglutide, tirzepatide, and resmetirom. I'll give you a simple explanation of what each drug is, when and how they are used, what benefits they bring, and what other medications are being studied right now. Let's start. A quick roadmap. First, a one-line roadmap. Semaglutide and tirzepatide are incretin-based agents used for weight loss and diabetes that also reduce liver fat and improve NASH features. Resmetirom is a liver-directed oral medicine, and it's a thyroid receptor beta agonist developed to reduce liver fat and fibrosis. That is the MASH and NASH. I'll explain each now. First, semaglutide. What it is? Semaglutide is a GLP-1 receptor agonist, a weekly injectable medicine already used worldwide for type 2 diabetes and for weight management. Recent large studies in patients with metabolic dysfunction associated steatohepatitis, previously called NASH, now it is called MASH, showed that semaglutide produces meaningful weight loss, improves steatohepatitis, and reduced fibrosis progression compared with placebo in a phase 3 study. So the question, when and how it's used. Currently, semaglutide is primarily prescribed for diabetes and weight loss. Its MASH benefits make it a promising choice for patients with fatty liver who also have obesity or diabetes. And remember, most of fatty liver patients, they are obese, and good number of them, they are diabetic. Use and dose for liver disease are being evaluated in late stage trials, and regulatory filing. So in practice, a hepatologist or endocrinologist considers a semaglutide when there are coexisting diabetes, obesity, and fatty liver disease with careful monitoring. Main benefits and cautions of semaglutide. Benefits seen in trial: substantial weight loss, which itself reduces liver fat, higher rates of MASH resolution, and reduced progression of fibrosis versus placebo in the trial group. The most common side effects are gastrointestinal, that is nausea, diarrhea, and weight loss drugs may have other metabolic effects. So patients need medical supervision. Semaglutide is not a standalone magic pill for all fatty liver patients. Its greatest value is in people with metabolic risk factors. Know the second drug, tirzepatide. What it is? Tirzepatide is a newer injectable that activates both GIP and GLP-1 receptors, a dual incretin. It has shown very strong weight loss results and importantly for liver disease, has produced high rates of MASH resolution and improvements in liver. It improves liver fat, liver biochemistry, and non-invasive fibrosis markers in clinical trials. For example, Synergy, NASH, and related studies. When and how it is used, tirzepatide. In clinical practice today, tirzepatide is frequently used for diabetes and for pharmacologic weight loss when available are approved locally, and in Pakistan it is now available and approved. Its effects on fatty liver are an important reason clinicians consider it when patients have obesity plus fatty liver. Dosing and for formal liver disease indications are under regulatory review and study. So use for NASH is usually in consultation with specialists and according to the latest guidelines trials. The main benefits and cautions of tirzepatide. Benefits in trials: larger average weight loss than many prior agents. This is the benefit. Strong reductions in liver fat and higher rates of MASH resolution in trial arms. The side effects profile is similar to GLP-1 drugs, primarily GI symptoms. And as with any powerful metabolic drug, patients are monitored for safety, tolerance, and interactions. Now the resmetirom, what it is. Resmetirom is an oral selective thyroid hormone receptor beta agonist designed to act primarily on the liver to reduce hepatic fat and improve fibrosis markers. It is the first liver-targeted medicine to receive accelerated regulatory approval for MASH in recent years, making an important change in how we treat advanced fatty liver disease. When and how it is used. Answer to this question is, unlike semaglutide and tirzepatide, which are primarily anti-diabetic weight drugs with liver benefits, resmetirom is developed specifically for moderate to advanced MASH with fibrosis. Where approved, and in Pakistan it is approved and available, it is prescribed as a daily oral medicine in conjunction with diet and exercise, and typically used under hepatology supervision for patients with biopsy-proven or well-characterized MASH and fibrosis stage meeting regulatory levels. What are the main benefits and cautions with resmetirom? Clinical data showed resmetirom reduces liver fat and produced MASH resolution in a meaningful proportion of trial patients, and it was approved under accelerated pathway in jurisdictions that reviewed the data. Side effects reported include gastrointestinal symptoms and some liver-related events. So liver tests and clinical follow-up are essential while on treatment with resmetirom. So the next question comes, how clinicians decide which drug to use? This is very, very important. Selection depends on the patient. If obesity and diabetes dominate, incretin agents like semaglutide or tirzepatide are attractive because they treat those metabolic drivers and reduce liver fat. If a patient has established MASH with significant fibrosis, A liver-directed drug like resmetirom may be chosen according to approved indications and specialist judgment. Remember, in all cases, drug therapy is aided to, not substituted for, diet, weight management, exercise, and control of diabetes and lipids. Drugs help accelerate improvement or treat specific pathophysiology. Lifestyle remains the foundation. What are the benefits patients can expect from drug therapy? Realistic expectations: these drugs reduce liver fat, improve liver enzymes and inflammatory markers, and in many trial participants led to histologic NASH resolution or reduced fibrosis progression. They also improve weight, glycemic control, and cardiometabolic risk, which benefits overall health. But not every patient responds the same way. Remember, monitoring and individual plans are essential. What about the safety and monitoring of these drugs? Important safety points: these are GI side effects, and it includes nausea, diarrhea, are common with incretin agents, usually manageable. Resmetirom may have liver-related safety signals in some patients. Periodic liver tests are required. These drugs should be started and followed by a physician experienced in metabolic hepatic disease. They are not over-the-counter remedies. What are the other promising drugs in the pipeline? Beyond these three, many other classes are actively studied. Examples are PGF21 analogs, that is ruxifamine and others. They showed improvements in liver fat and fibrosis markers in trial. So in 2026, these will be probably available. Then PPR agonists and pain PPRs, that is linifibranor. It's a promising in terms of fibrosis and metabolic benefits. And phase 3 programs are ongoing, and hopefully we will get this drug in 2026 as well. Then the de novo lipogenesis lipid targeting agents, for example, Aramcol, phase 3 programs have reported antifibrotic signals, and this is going to be another drug available for fatty liver disease in 2026. Then FXR agonists, obeticholic acids, it had mixed regulatory history and safety concerns. Some trials and regulatory reviews, they continue, and it can be another drug in 2026, and it can come back. So the bottom line is, in MASH pipeline is active and diverse. Combinations, that is metabolic, liver-directed drugs, are likely to be future approaches. To summarize in plain words, dear viewers, semaglutide and tirzepatide are powerful metabolic drugs that also reduce liver fat and can help many patients with fatty liver, especially those with obesity or diabetes. Resmetirom is a liver-directed oral drug, now authorized in some jurisdictions for MASH with fibrosis, and others offer a targeted option for patients with established disease. All drug therapy is aided to lifestyle changes. This is very important. Diet, weight loss, and exercise, and must be prescribed and monitored by specialists. Inshallah, in the coming vlog, we shall be discussing how to monitor these patients after the therapy. When the therapy is successful, the liver fat is washed out, then how to monitor patients to prevent recurrence of the fatty liver. So be with me in the next vlog. We are discussing the very important aspect of post-treatment monitoring of patients with fatty liver disease. Till then, take care. Khuda Hafiz.